UW Health's contract negotiations with Anthem Blue Cross Blue Shield Wisconsin hit a snag last week.
So if a new deal is not reached, UW Health would no longer be in network for Anthem insurance customers. As Arman Rahman found, it's putting patients, including those who need complex care, on a road of uncertainty.
While Anthem Blue Cross Blue Shield Wisconsin and UW Health battle over price increases, patient families like Michaela Schultz and her mom are left looking at having to rebuild their medical care from the ground up.
This is affecting families like mine and my daughter.
Michaela Schultz has her routine
Do you want to listen to Netflix?
that help her relax and smile.
She is just happy. She loves music. She loves interacting with people. She loves dancing.
But this email from Michaela's hospital, UW Health, plunged her mom, Deborah, into
State of panic.
Michaela was diagnosed with Phelan-McDermid syndrome when she was a baby, a rare genetic disorder that causes a variety of symptoms.
She's got seizures, epileptic, kidney, heart. She's nonverbal. She is severely cognitively delayed.
She requires a complex team of about 20 physicians in neurology, cardiology, ophthalmology, and more that have not been easy to assemble.
And it just so happens that the physician that she has seen at 1 year old at the UW Neurology Department, he's still seeing her today.
If UW Health leaves Anthem's network, Deborah says the only other nearby hospital that's treated someone with Phelan-McDermid is in Milwaukee.
What about in the winter, if she has an emergency?
She called her insurance, which is through Blue Cross Blue Shield of Illinois.
And they said, well, Blue Cross is Blue Cross. Doesn't matter if you're Wisconsin or Illinois.
That's because her plan is part of the Blue Card program. That allows Illinois members who live in another state, like Wisconsin, to use hospitals in that state's Blue Cross network. But if, in this case, UW Health does end up leaving Anthem's network, they tell her,
It does affect you.
I reached out to both Anthem and Blue Cross of Illinois for information. Deborah was told she could apply for continuity of care to keep getting treatment at UW Health after April 15th for, quote, a limited time or until treatment concludes.
Are we going to have to basically wait for the shoe to drop? This is a lifelong thing that she was born with.
While Michaela requires a lot of unique attention, it's a mother-daughter journey like any other.
She's definitely guided me through a lot.
But now Deborah is left lost.
It's very heartbreaking.
On what comes next.
Who's going to take care of my daughter?
If a deal with Anthem is not reached, UW Health facilities affected on April 15th include Madison Surgery Center, Generations Fertility Care, UW Health Rehab Hospital, and Unity Point Meriter.
That's Arman Rahman, thank you. In statements about the negotiations, UW Health says, quote, many Anthem members rely on UW Health for health care needs, ranging from primary care to complex care like organ transplants, for which we are often the best and sometimes only option. Our goal is to reach a fair agreement that reflects the value of our care and ensures patients with Anthem insurance continue to have access to our care, end quote. Meanwhile, Anthem says in a statement, quote, we want UW Health to remain in our networks and will continue to work with them to reach an agreement. However, we cannot agree to excessive price increases that would only make health care less affordable for our members, end quote.